And today I want to talk to you about functional lab testing. So I'm Dr. Jane. I'm a naturopathic doctor and a natural fertility expert. And I help couples who have been struggling with infertility for over a year get to the root cause of their issues, heal, and conceive naturally. Now, one of the questions that I get is about lab testing. Some of you may feel like you have had all the lab testing done in the world and you still can't seem to find the answer as to why you haven't been able to conceive. And so I want to share with you the different types of lab testing that are out there, ones that are going to show us what's happening in the body and others that are showing us why it's happening. And the functional lab testing can be super, super helpful in understanding the function of the body, because I believe deep down in my soul with every fiber of my being that pregnancy is a natural process. So when it's not happening, something is missing. Something is missing in the function of either you or your partner's health that is impacting the quality of the egg, the quality of the sperm, or the environment that the baby's going to grow in, aka the womb. And functional lab testing is a great way to find out what that is. So let's dive right in. And I have my little notes here of things that I want to make sure I get answered because those are the questions you guys are asking. So what is functional lab testing? Just kind of like I talked about, there's labs that are going to show us what's happening, and then there's labs that are going to show us why it's happening. The what labs are usually your diagnostic labs. So think about blood work, think about ultrasounds, any MRIs, CT scans, anything that's going to literally tell us what is going on in the body. So from a functional standpoint of view, you can even think about things like food sensitivity testing or micronutrient testing, where this is telling us about what are the micronutrients that you have in your body or which food sensitivities that you have. And even hormone testing is considered a what test, not a why test, because hormones are not the root cause. So when I have couples coming to me and they're talking about all of the ways that they have tried to balance their hormones and they've never had their gut assessed or their environmental toxins, and those are the two tests we're going to talk about in a second, I know that they have missed a really big piece because hormones are not root causes. They are messengers, and so they're not the root cause of your issue. There's something else. Don't get me wrong. Your hormones are going to cause a lot of symptoms, but balancing your hormones without addressing your gut, your liver, your environmental toxic load is just you swimming upstream. And it feels obviously very frustrating because you're still spending time, energy, and money, but you're just not getting anywhere. So the what lab tests are going to be your diagnostic tests or tests that literally will show you what is happening in your blood, for example, or in your urine, or, food sensitivities, micronutrients, that kind of stuff. The micronutrient test analysis is something that I run on some of my patients, not all, but I find that that's a really great way to assess what nutrients the person is missing so that we can address the deficiencies really quickly to help us gain some momentum. So if you've been struggling for a really long time and you've been taking a bunch of supplements and it feels like nothing has really worked, when you look at a test and it shows you exactly the nutrients that you're missing and which ones are fine, as soon as you supplement with the nutrients that you're missing, you're going to notice a difference. It's not going to be a long-lasting difference, but you are going to notice a difference. And the reason it's not a long-lasting difference is because nutrient deficiencies are not root causes. If that was the case, if you would take B12 because you had low B12, all of your problems would go away. And that's just not the case. That's not what's happening. Even though it can be useful to supplement with B12, in the meantime, to help bring your energy up, bring your focus up, or your mood up, it's not going to treat the root cause. And so you're going to rely on that B12 for a long time, or eventually it's not going to have that same effect. And that's why people get frustrated because they felt better and then it kind of stopped working. So those are the what tests. They show us what's happening in the body. The why tests are the tests that show us why it's happening. So if we have a B12 deficiency, why is that B12 deficiency there? Is it because you're not eating enough of the actual foods that contain B12? Are you not absorbing those foods, or are you using it up too quickly? For example, if you have a lot of heavy bleeding, you're going to use up a lot of B12 and a lot of iron. If you have stomach issues, whether it's H. pylori or GERD, so heartburn, indigestion, you're not going to be very good at absorbing B12. And then maybe if you're eating more of a vegetarian or even a vegan diet, you're not consuming enough B12. So which of those three things is causing the issues? And now B12 deficiency is just a one tiny example, but this is my thought process for every single symptom or every single nutrient deficiency that I see. So if I see vitamin D deficiency, then I think about what's going on in the immune system, what's going on with the mood and the neurotransmitters, what's going on with hormones. Why is that issue there? Are we not absorbing it? Are we not eating it? Or is something taking away from your system, meaning you need a lot more of it because there's a chronic infection that's going on. So your immune system is revved up, so you're going to need more nutrients. The same thing when we look at high estrogen or low progesterone. Okay, I have low progesterone. Why do I have low progesterone? Is it because I don't have the nutrients to be able to build it? Am I not absorbing it? Or is there something taking away? So that's my filter. And the tests that I personally run to help me find out why you have the issues that you have. So like I said, I want to know what hormone imbalances you have. I want to know what nutrient deficiencies you have and what the function of your kidney and your liver and your gallbladder and just your electrolytes. I still want to know all of that information because that allows me to understand where your body is at and how can we best support it so it has energy, because healing takes energy. And so if the body is really tanked and you're trying to heal and detox, you're not going to feel very good. So we want to be mindful of how our detoxification organs are working and what our energy levels are. But the test that I run to help me get to the root cause of your symptoms and your infertility struggles is a gut stool analysis and environmental toxins. I also run an organic acid test. There's also some like co-infection Lyme tests that you could do. There's some neurotransmitter tests that you can do as well. The world of functional lab testing has evolved tremendously over the last 5 years, and it's just going to continue to evolve. And the reason that I'm sharing a bunch of this information, you guys, is I don't ever want you to feel like you have no explanation for your symptoms. In our day and age, you can absolutely have an explanation. You just have to want to, number one, find out the explanation and find the right practitioners who are going to dig for you. And then there's an investment component as well into figuring out the root cause of your problems. So the gut stool analysis and the environmental toxins and the organic acid is the main ones that I'll run for most people. So I'm going to talk about that as a generality to help you guys understand why I run those. So the gut function is the epicenter of our health. And even though there is no test that's perfect out there when it comes to testing your stool analysis, we can still get a pretty good idea of what's going on. The imbalance of your good bacteria versus bad bacteria, opportunistic bacteria, yeast and fungus overgrowth. You can detect parasites sometimes, not all the time, but you can detect them through stool analysis. I run the Gut Zoomer analysis by Vibrant America, and I love it because they have like 8 different inflammatory markers. So we can literally see how inflamed your gut is, the mucosal lining, and depending on what inflammatory marker is elevated, we can see what is causing that inflammation. Is it a bacteria? Is it a virus? Is it a parasite, right? Is it an allergic reaction, or is it just like mucus lining degrading? So that's really important, because when I talked about seeing, okay, you have a B12 deficiency, are you not eating enough of it? Are you not absorbing it, or it's being used up for something else? The absorption portion is really important. Whoa, you can see if you're breaking down your foods and if you're not. Is your mucosal lining have a lot of integrity? Does your mucosal lining have a lot of integrity, or is it really weak and frail and breaking down and jacking up your immune system? Is your immune system jacked up, or is that immune system really struggling now because it has been so jacked up for so long These are all the things that we can see through the stool analysis. We can also see how you're breaking down estrogen. If you have excess of certain bacteria that's causing you to have more estrogen, so you're not very good at getting rid of the estrogen and you're essentially just recycling it back in the system. So that is an incredible amount of information. And sometimes there's only like 3 or 4 markers that pop up that are red. And sometimes there's like 20. And that's not a good or a bad. I think what we're doing with testing, we're either ruling something in or we're ruling it out. And ruling something out is just as important as ruling it in. For example, autoimmune disease. Like I always screen all of my patients with 4 autoimmune markers, male and female, because it's an easy test that you can do that rules it out and we're not missing anything. So a stool analysis is the same thing where you could have really good insight into what's going on with the gut, how inflamed it is, the type of bacteria you have. And I can almost tell you what symptoms you're experiencing before if I ran my tests backwards, so I ran the tests and then you came to see me for my initial consult, then I would probably be able to tell you the kind of symptoms that you're experiencing just by looking at the test. But of course, the beauty is not just by running the test. The beauty is in having someone listen to you and help you understand the symptoms that you're experiencing and how long you've had these symptoms for. That's really important. And then, of course, running the testing and interpreting it for you. The second test that I find super, super valuable, especially when we're talking about hormones, is the environmental toxic panel. So I run, again, by Vibrant America. It's a total tox burden test, and it runs your industrial environmental toxins, your heavy metals, and then your mold markers as well. And then I add an organic acid panel to that. So these are all urine analysis. And the reason that I do that is, number one, I don't want to miss anything. So by the time my patients come to me, they've already tried a bunch of stuff. They've already had a bunch of doctors told them that their labs are normal, and they just want answers. And to be honest, so do I, because to me, it's puzzling when I see a couple that's like 30 to 35 or even to 37 who have been trying to conceive for anywhere between 2 to 5 years, who seem healthy, like they prioritize their health, they try to exercise, they're not eating processed foods, but they just can't seem to get pregnant. It is puzzling, right? And that's where our physiology just hasn't changed that much. And if pregnancy is a natural process, something is missing. And usually it's something that's in the environment that the couple is not aware of, whether it's current or past environment, that is causing some damage to their health and, more importantly, damage to their mitochondria. So a mitochondria, the powerhouse of the cell, is very susceptible to environmental toxins. And the mitochondria is where we make hormones. We make our sex hormones like testosterone, progesterone, and estrogen. We also make cortisol. So when people have issues with those hormones, whether it's low progesterone or low testosterone or high estrogen or low estrogen, or you have cortisol issues, aka adrenal fatigue, it's actually a mitochondrial dysfunction issue. And that's why we have to look at environmental toxins, because some of my patients have had really bad exposures when they were kids. And whether it was a Lyme infection that they had, they didn't think anything of it because, of course, their parents didn't think anything of it. Or it's a heavy metal toxicity exposure or secondhand exposure or something that got stuck in their system and is now dictating a lot of their health still to date because it was never brought to their awareness, and they're continuing to expose themselves to that toxin on a low level. For example, heavy metals. You might not realize that there's heavy metals in your water depending on the area that you live in the state or the province, and you're just drinking your Brita filtered water or even Berkey and you're thinking this is enough, but I can see it in the lab testing. What are the things that are causing issues and where could the possible source be? So the environmental toxin panel is very, very helpful. And I'm telling you, like, I have never, even myself, have never had it completely clear. Not yet anyways. I'm working on some stubborn heavy metals that just take time to get out of your system. But it's not to say that all the other markers are not up. Once the body is used to and getting rid of stuff, like it's just going to keep getting rid of stuff. Our body is designed and built to get rid of toxins toxins. It has these processes inside our liver, our kidneys, our gut, our skin. Problem is we're so bombarded. We're so bombarded with toxins and we don't even know where they're coming from. So it's this lack of awareness that's causing the bigger issue, if anything, because you're not aware of how much you are exposed. And then you don't really know how to keep your system clean. And so the load constantly keeps growing. And that impacts your mitochondria for both males and females. Really important for egg quality health, really important for sperm quality health, and like I said, energy production and hormones. So the environmental toxin panel, I look at the industrial toxins, the heavy metals, and the mold. Mold is big as well, depending on where you live. And also, this is where genetics are going to come in place. Some people metabolize mold really easily, while others don't. That's not a right or a wrong. We all have an ability to metabolize mold, but some of us are not as good. So we have to be aware of mold if we have it in our current or past environment. Where could it be coming from and how to detox from it? Because mold, again, is going to really impact mitochondria. It's going to screw up your hormones, your metabolism. It causes so much inflammation. Your immune system is upregulated. And then you add some poor gut function to that, your body is going to be overwhelmed. The last thing your body's thinking about is like, oh, let's get pregnant while you have this insane amount of mold. And so that's kind of the most, with mold, I would say if I see anything is probably a lot of recurrent pregnancy loss. That's just clinical experience. That's not anything that I would say in research that is for sure associated, but personally with patients that I have worked with who struggled with recurrent pregnancy loss had a lot of mold and yeast and fungus. And so when you clear that out, they feel much better. And then of course they can carry to term. So I look at those three and then I look at organic acids, and organic acids is basically how you're metabolizing and breaking down your nutrients, even bacteria, your neurotransmitters, your energy metabolism, carbohydrates, fats, proteins. And then we looks at different yeast markers as well as different bacterial markers as well. And so I find that there's always kind of red flags and then there's yellow flags. That's, we have to, when we look at the whole picture for infertility, or at least this is how I do it, I am looking at what are the red flags and then what are the yellow flags. And sometimes there's not a lot of red flags, but there's a lot of yellow, and those yellows will be adding up to the red. So you might have some mold that shows up in the mold panel, and then you have a little bit of a sluggish digestion that pops up. And then you have these yeast bacterial markers that also show up in the organic acid. Being able to interpret and understand and then put the pieces together what the patient is going through as well in terms of the symptoms, and not just fertility symptoms, right? Okay, if you have recurrent pregnancy loss, that's an obvious issue, but what about your energy level? What about your PMS? What about your menstrual cycle, your white cervical fluid production, brain fog, skin, any eczema reactions, maybe it's difficulty breathing, watery eyes, allergies. All those things are signs and symptoms that your body's trying to cope. So we want to connect and put those pieces together. So those are going to be the most common, if you will, of functional lab testing that I will run to help me understand the whole picture of what's going on. And I personally do not recommend any lab testing until I have the initial consultation, because a lot of my patients have had a bunch of labs done already. So I want to take a look at what they have had done, what has been missed, what has been interpreted properly. A lot of my patients have no idea what their labs mean. So if you don't even have copies of your lab work, I highly recommend that you start keeping it. This is your data. And a lot of my patients, I just took one on and they're not getting pregnant. So secondary infertility, kind of unexplained. And she has low testosterone. Now, it's not that that conventional doctor would have helped her, because obviously they didn't even look at her testing or cared to mention that she had low testosterone. That's a huge sign for you if you're learning to advocate for yourself, to be like, whoa, if my doctor is not even paying attention to my labs, do they really care? So having those copies of your lab work is important. And I don't prescribe the lab work until I sit down and meet with people. And then I do not prescribe supplements until we get the lab work back. We'll do some foundational pieces, like whether it's improving your sleep or hydration or movement or nutrition. Like there's always something that we could be improving while we're waiting for the lab work. But I don't actually give you the protocol until I see it, because that's why we ran the lab work. I don't want to guess. I don't want to guess as to what's going on. I want to see the lab work, and then I want to give you a protocol that's actually going to work. So that kind of brings me to the next popular question is like, can my doctor run these for me, or who can run these tests for me? So functional lab testing is not something your conventional doctor is trained in. They're not trained in nutrition, they're not trained in supplementation, and they're not trained to read functional lab testing. They're trained in pharmaceuticals and interventions. So I would go ahead and far say it's like they're not the right people to run that test. Now, you might be listening to this and like, oh, my doctor offers these tests. If you're looking to get this kind of lab work done, this is something that the practitioner should already be doing. This isn't something that you should be asking your practitioner to do, because I've been running lab tests basically since I've graduated, which was in 2014. And I got pretty heavy into functional lab testing like a couple years after, because I just did some blood work. And then I realized that that wasn't enough information. After a couple of years of practice, I'm like, I'm not getting anywhere. So then I got into more functional lab testing. And if you have to ask your doctor to run these tests, chances are they do not know what they're interpreting. It is a tool that you have to learn how to use. And I myself have ran a lot of functional lab testing on myself through the years. I've done the food sensitivities, the micronutrient testing. I've done probably 4 or 5 different stool analysis at this point, as well as my husband, at least 4 or 5 different urine analysis at this point as well, just to make sure that I can grasp and understand the power of these labs, because these labs are really powerful, but your labs are only as good as your interpreter. So if you want somebody to run these labs, that's something that they should be offering at the forefront. You should be having a conversation. For example, in order to work with me, you have to jump on a mini clarity call where you get to know how I practice, but I get to know what you have tried and what's worked for you and what hasn't worked for you. And the point of that is to see if what you're looking for is something that I can even offer. So I encourage you to do those interviews with practitioners and ask them, what kind of testing are you doing? And, what kind of results do you get from the testing, and why do you run the testing? If you have to ask your practitioner, they're just not going to know. So I hope that answers that question. And the last one I get is the cost. Like, what should be the investment when it comes to lab testing? I don't want to say it depends on the practitioner, because it doesn't necessarily depend on the practitioner, but it depends how many tests you run at the same time. I run a lot of stuff at the same time. I run blood work, day 3, day 21. I run a bunch of genetic markers within that blood work, including MTHFR, including factors 2 through 8 to rule out any clotting issues, autoimmune, thyroid panel. And then I run the stool analysis, the environmental toxic panel, plus the organic acids. And sometimes I'll run the Dutch, depending on what's going on with the person. And again, the reason that I run everything all at once is because my patients want answers and I want answers. And after sitting down with my patients for 2 hours, listening to them and figuring out their story and their symptoms, now I need to run the lab testing to help me fill in the puzzle so I can understand what's going on with the story. Because again, my filter is pregnancy is a natural process. If it's not happening, what's missing? When you're looking at running everything, then you're looking at a couple $1,000s at least. You're looking at anywhere between $3,000, I would say, to $7,000 of investing into lab testing. And that depends on if you're running that for both of your partners versus just yourself. So in my instance, both of my partners will run all of the lab work. Sometimes the guys don't need all of the lab work, but they just need the blood. And then, of course, we're talking about budget with my patients as well. But none of my patients ever regret doing lab testing. None of them. Like, no one has ever said, man, I wish I didn't do the lab testing, because it's the most comprehensive thing that they've ever seen. And it's the first time they've ever actually gotten answers or possible answers to their issues. Because of course, for example, with recurrent pregnancy loss, or even unexplained infertility, it's hard to know exactly why you're not getting pregnant, but you could see that there is a lot of yeast, there is a lot of mold, there's a lot of heavy metals, and the liver is not functioning well. And so it's a pretty good likelihood that's the reason why you're not getting pregnant. And so we get to work and we start improving your health and therefore your hormones, your fertility. And then I retest blood work. I don't retest the stool and the environmental toxin panel that often. Usually 6 months minimum is what you want to give it. But typically it's more like 9, 10, or 12 months. And by that time, most of my patients are pregnant, so we don't need to retest it. If you're running a lot, I would expect you to spend a couple $1,000s on lab testing. Again, the test is only going to be as good as the interpreter. Is this something that you should be figuring out on your own? I see a lot of my colleagues posting it on their website, like order your test here, order your test here. And don't get me wrong, I think it's really great that now we have access to these tests. But if there's nobody who's interpreting them for you, what are you going to do with that information? Don't waste money on a test that you don't have somebody to interpret for you. So then you're just going to guess and take a supplement protocol because of something that you saw, and you don't even know if that's the most important thing you need to deal with or if it's something else. My training as a naturopathic doctor is like doctor as teacher. So I teach my patients to help them understand. And quite honestly, that's how I understand things too. That's how I make sense of it, as I go through stuff and then I can draw it out and connect the dots, because we want to be working on the thing that's going to move the needle the most. So the lab testing, like I said, no one ever regrets doing it because it gives you so much information, and we have to be patient to get the labs, right? It takes about 2 to 3 weeks. But when we hit that target, we hit it right on the nose. We are not guessing anymore. We're not wondering what is causing issues. We're not wondering what's the thing that's going to move the needle the most for you. Like, I can literally see how you're breaking down carbohydrates and if energy is going into your cells or if it's stopping somewhere in the Krebs cycle. I can also look at mitochondrial function. When we have the whole picture, then there's things that we need to do right away and then things that we're going to do down the road. For example, if you have heavy metals, we're not going to detox heavy metals right off the bat. That's usually a 3 or 4, even a 6-month thing down the road, depending on what else is going on. So lab tests are really powerful in being able to outline everything and then help us, because your body should be changing and shifting. I always like to draw the staircase for my patients. What you're doing today is going to be very different than what you need to be doing a month from now, or 2 months from now, or 3 months from now. If you're doing the same thing over and over again and you're not getting any results, that's the definition of insanity, but it's also a sign that you're putting energy into the wrong place. You're not actually addressing the issue. The example that I like to use that, and this is what I'll leave you off with, is the deadlift. So if you guys are familiar with any weightlifting, a deadlift is when the bar is on the ground and you pick it up to your hips. You just stand the bar up to your hips. In order to have a good deadlift, you need good leg strength, you need good back strength, and you need good grip strength. Your arms, your hands need to be strong. And so if your grip can only hold on to 200 pounds, but your legs and your back can lift 500 pounds, your max deadlift is still only 200 pounds. And so if you then go to the gym and say, I want to get stronger, and you start doing all of this work, improving your leg and your back strength, but you completely miss the grip, when you go to retest your deadlift, it's going to be at the same number. And that's really frustrating because it's easy to say, well, I guess my deadlift max is just a 200 pounds. But that's not what it is. You actually just missed the constraint. The constraint is the grip. So if you go back to the gym and start working on your grip, and then the following month your deadlift jumps up by 50 pounds, that's how you know you're moving in the right direction. And so that is true for fertility and your health. If you're putting time and energy into your fertility and you're not improving every month, now I'm not saying your improvements have to be huge, but you need to see improvements, whether it's in your energy, in your skin, in your bowel movements, in your PMS, in your white cervical fluid production, in your actual menstrual cycle, something. You need to see improvements. And if you're not, that means you're focusing on the wrong thing. And so we want to be able to pivot and turn as quickly as we can. But this is why we use lab testing, because sometimes symptoms are really confusing and we've done a lot of stuff and we don't really know what to do. So that functional lab testing can really help us save some time. I know it can seem like a really big investment, but what is your time worth? That time is really valuable. We don't want to be wasting time. We don't want to be wasting money on procedures that literally make us feel like we have nothing to show for it. And to me, it's not enough to say, but maybe it will. And that 20 or 25% chance that you're given in the first round of IVF, it's like, that sounds terrible to me. I'd rather have answers. And so that's what I do with my patients, because when you have answers and you feel actually good in your body and you rebuild strength, energy, vitality, there's a confidence that grows with that. And then obviously the pregnancy occurs. It might not seem as quick, but it definitely is worth it. So I hope you guys found this episode helpful. If you have any more questions about functional lab testing and why I do it, or what kind of testing, or even something that maybe you've already done, if that's valuable, I appreciate all the questions. So go ahead and send us a message through the DMs on Instagram and we'll get to them. But otherwise, thanks so much for being here. Thanks so much for listening, and I'll see you next week.